going to talk about the benefits of this course, and I'm just going to start out by saying that I've been in private practice for 6 years as a holistic orientation advocate. And when I started my course, when I started my work, there were no courses that I could afford anywhere in the United States to help me learn how to do this. So I just garnered all of my networking and extreme Google skills to figure out how to go into private practice in the mountains here of Western North Carolina. And it was my great honor and privilege to create a school for nurses to do that. We started with our first cohort of our students. This course is 6 months old or long, and we started our first cohort in October of 2019. Currently, we are on our third cohort. So one of the reasons I wanted to go into private practice is that I was feeling unfilled with the working conditions of many hospitals, feeling like I was not the owner of my own destiny, and I was feeling trapped, like there were no jobs that I wanted to do where I could give patients and families the care and thoughtfulness and nurturance that they needed. So a couple of other things about me is about 14 years ago, I attended one of Linda Bark's courses on how to become a nurse coach. And I actually took that course 3 times in a row. And then I actually started working for her as an assistant faculty for Wisdom of the Whole. So one of the things I learned is that we as nurses teach, we actually are in the habit of telling patients and families what to do. And then when you are taking the coaching content, one of the things is to learn to ask powerful questions and to pay really attention to what the person or the patient or the family want from you. And then they are the ones that are leading you down their path with your help. So coaching is a huge part that underpins this course. So we have about 20 content experts who teach during this course, and we have 7 modules that this course is built around. So I'm briefly just going to show you that, and then we can take questions. But so this course is going to start on Wednesday, May 12th, and it will end on Wednesday, November 10th. Every course will be, each night will be 7 p.m. to 9 p.m. on Wednesdays. This course has been approved Eastern Time. Thank you, Linda. This course is approved for 60 contact hours by the American Holistic Nurse Association on holistic orientation, advocacy, and nurse coaching. So we have 8 modules that the classes all fall into. So the first one is building the foundation and establishing the relationship with the client. You're going to be learning about nurse coaching skills throughout the entire length of the course. We have a module called Part 1 on business development. We have another module called Navigating the U.S. Healthcare System and Healthcare Site Reviews. We focus a lot on self-care skills and strategies as independent nursing care owners. We have a module called Care Planning, Setting Up Accountability and Measuring Success. We have another Part 2 on building your own business. And then the last module is called the Holistic Orientation Advocacy Case Study Presentation, which we pull it all together for our students. We gear our courses so that every Wednesday night we have a lot of interaction and thoughtful discussion about the content. How does it affect you? We also provide all of our documents, our books, our presentations, and content to you. And this is an example of Linda has these 30 fabulous Wisdom of the Whole cards. And these are a lot of the tools that she will teach you. I'm just flipping this so you will see there's a whole lot of wonderful. I still use these cards a lot when I work with clients. Then we have her book that she wrote, which was the American Nurse Association Professional Book of the Year. Do I have that right, Linda? This is called Wisdom of the Whole, Coaching for Joy, Health, and Success. So each student gets that book. Then we are doing some other insightful work in helping each student know what type they are on the Enneagram scale. This is a personality type structure. This is called the Essential Enneagram by David Daniels and Virginia Price. We have a nationally recognized expert on that here in Asheville. And then one of the things we're evaluating is whether we're going to use this book called the One-Page Business Plan by Jim Horan, so that we can help our students develop a one-page business plan. So sometimes when I was thoughtful and introspective about my own career path, I was tired and I was worn out, and I didn't have control over my schedule, and I didn't feel like I had enough time to devote to my patients. So now one of the things about working in a private practice is I can set my own schedule. I can go hiking in the morning and then start seeing patients at 10 or 11 o'clock, or I can start my day early and then hike in the afternoon. I can see patients on the weekend if I want to, or return calls at night based on the emergency or the immediacy of patients and families' desires and needs. There's a strong emphasis on application and integration here, and we are really fortunate to have these incredible speakers that come and talk about the content. So there's a lot of wonderful things about the course. We also focus on your own Nurse Practice Act. So what we have each of the students learn about their own Nurse Practice Act, the American Nurse Association Code of Ethics, and also some other issues regarding your own nursing work here in each state. So we've talked about flexibility. We've talked about this course having contact hours, and taking this course really is an investment in yourself in terms of your growth and development. And just want to focus that we do inner landscape work as well as working on your business. So what is your mental, physical, emotional, psychological, spiritual, environmental, and financial needs? What's going on with you all in terms of what's keeping you from doing your great work? So becoming a holistic orientation advocate is my great work, and it is my great desire to help you as your teacher learn how to do this. And by taking this course, you're going to learn all about my mistakes that I've used and I've done, and all of the lessons learned that we want to help you do this course.